Hi there. I went to the Swedish Institute for Massage Therapy in New York City, as well as a bunch of continuing ed classes to learn how to give a good massage. But it's not just that. It's not just the techniques. It's all about what goes into giving a good massage day in and day out. So the techniques I learned were neuromuscular/medical, Swedish, and shiatsu. Neuromuscular, as Delaney puts it, is learning about the root of the problem before it becomes an injury in the muscle. Swedish is very focused on relaxation, long strokes, a lot of gentle rocking, and just a nice overall massage. Shiatsu is really interesting because it's actually acupuncture without the needles. And so you learn about the theory of Chinese medicine, so you can treat both physical as well as emotional imbalances. Massage was a great career for me because I got to meet an amazing amount of people from all kinds of backgrounds. I met a renowned historian, I met the owner of FAO Schwartz, one of the lead singers of Beastie Boys and Ivanka, as well as a bunch of less famous but really amazing people. So I want to know how many of you have actually had massage, and was it a good massage, and what made it good? Okay. If you think about it, massage, you're touching strangers and you're asking them to trust you with their bodies and also relax. So I want to talk about what I think makes a good massage. It's actually a complex umbrella of modalities, but there's not really one magic technique. It's kind of like everything you bring to it. It's not just techniques and strokes, but it's everything involved. So what I think it involves is the knowledge that you get from school of anatomy, physiology, pathology, being centered in yourself, and have confidence that you know what you're doing. And so with some of that takes time, but a lot of it is also knowledge from school. By building trust while utilizing your skills you've developed is another factor in a good massage. And also knowing how to deal with the effects of emotional events that happen to people and how it impacts their bodies. This is actually a really powerful position to be in. You have to have a lot of humility to do it right, though, I think. So for me, it was a great career. You get to know a wide range of people. I got to know my current wife, but that's a story for later. You expend a good amount of energy, but at the same time, you actually get energized as you're working. And you get pretty well paid for bringing relief and relaxation to people. So now I'd like to explain more about how incorporating trust, knowledge, skill, subtlety, and love can have you give a good massage. So to paraphrase the massage therapist Whitney Lowe, you'd better know what you know before you touch anyone. So you start by talking to somebody, you get a phone call from them, and you talk about what's going on with them, what they need from you, if there's any diagnosis, if they've got any injuries, and then you can help diagnose their issues. So this point is reiterated by Sandra Grace when she states that all natural medicine practitioners have a responsibility to be able to determine whether their clients are suitable to be worked on or whether they need medical attention from their doctor. Because sometimes massage can make conditions worse. Like with cancer, if you massage too deeply on a superficial tumor, you could actually have it break and make the cancer worse. As well as with people who are pregnant, if you work on certain points, you can actually induce labor, and you don't want that too early. So, but if you have a highly skilled massage therapist, you can actually bring relief to these people, and everybody needs to be touched. So with cancer, some results are improved sleep, reduced fatigue, reduced anxiety and depression, less nausea and constipation, and actually an improved immune system function and quality of life. In 2019, Nakano et al. Did a study using an EEG on the elderly, And it showed that with even just a 15-minute hand or foot massage, you can improve their quality of life. So what happens is sometimes when people get old and ill, people forget to touch them. And so it brings on depression and sadness and feeling of loneliness, but just with a little bit of touch, it can make a huge difference in people's lives. So how do you create this trust to let them touch you? I think it's confidence, a firm touch, gentle intent. You're able to read the body and muscle tone, and trust your instincts, and also communicate with the client. You're going to ask them how they're doing. You're checking in with them to make sure everything's okay. So this brings me to the next topic of how to actually work on the body. I think one of the biggest aspects of massage is to have excellent boundaries. So when I met my wife, we didn't know each other, and she came for a massage, and soon after she started flirting with me, and I knew that she had feelings for me. What she didn't know after 3 years was that I had feelings for her too. They were really strong, but because I had boundaries when we were working together, she had no clue. So what I'm saying is that I think that it brings the thoughts that you bring to the table, the energy that you bring to the table is reflected in your work. And so if you want your work to be just about massage and the energy that you can bring people, then that's what it is. But if you bring in weird thoughts and start getting creepy, people are going to feel it. It comes through in your hands. So don't be creepy. So this also is helpful because people come in with both physical and emotional issues. And you'll learn to see the difference between both, and you learn how to work with both. But it's important that you're able to recognize and have good boundaries so that you don't take on their issues. So the bones of the massage, how I worked was people would come in and I would kind of like gently rock their bodies. I'd rock the length of their bodies, and so I would do an assessment while I was working on them. We'd be able to chit chat. I could figure out what was going on with them that day, and also it helps with relaxation. And then you could always you want their head to relax as well as their muscles. So you do the relaxation to start to warm up the muscles. You do the long strokes, and then you start working smaller and start loosening up any adhesions they've got in their muscles, because you want their muscles to be supple and warm and free and no adhesions. And so you also want an awareness of what's going on inside their body so that you can help that. And a lot of people aren't aware of any kind of like muscular stuff, any kind of bone stuff, or even emotional stuff that's going on in their body until they lay down on the table. And so you can help with that as a massage therapist. And I think bringing all that together really helps make a good massage. So let's look more into the elements of the emotional parts of a massage. So Dr. John Sarno states in his book that, quote, "The majority of practicing physicians today do not generally consider that emotions play a significant role causing physical disorders," quote. This concept is rarely discussed, and people are constantly bringing their emotional trauma in their bodies with them when they come to get some work. And so massage therapists call it issues in the tissues. And the way that I've noticed how it works is that the less important the stress is, just stress from work, stress from driving, emotional stuff, if it's not that big, it just kind of like sits in the upper part of your body in the more superficial tissues and the more superficial muscles. But the deeper the emotional trauma, it goes down into your body further and then kind of lodges itself into your muscles. And so there's not really any physical or medical way to describe it, because there's nothing wrong with your bones or your discs or your muscles necessarily, but still you've got all this pain going on and you can't explain it. So it's really interesting how it works. And I'd love to get into it more, but time is of the essence. So how to give a good massage, as far as I'm concerned, isn't just about the technique. It's about everything you bring to the table. And so I think it's about starting with a great education, you got to learn a bunch of modalities and as well as pathologies, because you're dealing with a lot of people with illnesses and stuff. And so you've got a good start there. Having practiced so that you've got a great touch is hugely important, so that you could work with confidence, tenderness with emotions, and true love for your work and your clients. And finally, this is a career which affords you a great emotional connection and a diverse daily workload, and one of the most rewarding jobs out there. And if you can find a career where you can give as much as you receive, you're on a good track for emotional peace. Thank you.